Hello everyone, welcome to Ortho Implants for Life. This week we will be discussing about etiquette required to become an orthopedic OT assistant. We are dubbing the previous version of the discussion with Dr. Arindam Banerjee at the request of a few of our audience. If you want to check out the actual video in Bengali or the previous episode, click on the I button and watch it.
Today I'm going to talk about etiquette, which is the most important thing. We all know about IQ. IQ is the measurement of intelligence. We want our orthopedic OT assistant to be intelligent and practical. EQ, which is emotional quotient, is much more important than IQ. The emotional quotient defines one's attitude. If an assistant does not develop his attitude, then it will be very difficult for the surgeon to do his job. In any case, the surgeon will not want to take that assistant. The assistant should be pleasant and likable for the surgeon as well as the surgical team. The assistant's temperament and attitude should be good. I have worked with many technicians who have great knowledge, skills, and IQ, but they don't like to work as a team player. All the time they had attitude problem. I prefer those assistants who want to learn, who have a good temperament. Even if he knows, he doesn't push himself. No matter how much knowledge you have, try to work as a good team player. People will accept you. There are a lot of other factors as well, like first is honesty. Because technicians deal with the clients directly a lot of times. We allow them to deal with the client a lot of times. Sometimes tell them to go to their home to do the dressing and take off stitches. But if we find that assistant is charging way more than the normal to go to the client's space or patient's home, then that becomes a negative point. The second factor is good behavior. Good behavior is not only with the surgeon, but also with the patient. One has to maintain good behavior with the patient also. The patient is like a god to the hospital or to the surgeon. There is a lot of violence that is getting occurred nowadays against doctors and the medical fraternity. There could be a lot of reasons, like patients are stressed. They might have monetary problems, they might have conflict within family, maybe they are unable to withdraw their money from the Mediclaim. There could be a lot of reasons. For that, we need to handle them in a proper way, so that they are pleased and understand the hospital or the medical employees are helping them in a good way. One should keep in contact or show follow-up with the patient once a day after discharge from the hospital. It's pretty difficult for every surgeon to keep track and follow up with every patient after the discharge. But for that, we have a follow-up assistant. The follow-up assistant should go to their place. It's necessary to keep their phone number or get in touch over WhatsApp if possible. Keeping the track records of the report is necessary. Sterilization in operation is the most important thing. If that fails, the operation can also fail. The process of sterilization, if not done properly, any operation will fail. It might cause infection. One should know how to sterilize. Washing hands, washing equipment, wearing a mask, or taking all the necessary precautions for COVID. A phone call is very important. Nowadays, everything is pre-led over phone calls. if the patient calls you up or the patient calls up a doctor, if he is not being able to pick up or answer the call, at that point of time, they should call back, understand the patient needs. Even if the patient is stressed out, he or she has to handle in proper manner. One more point which is important is a basic computer knowledge and a basic knowledge of communication over English. Technicians get 50% of the income from a home assistant, like if a doctor asks them to go to the patient's place to do the dressing or to cut the stitch. 50% of their income is from home service only. So I would like to tell you one thing, that if you are getting the fees, ask them for a fair fee. Don't be greedy. Be very straightforward. A technician needs to get appreciated by the patient party. If you are getting good feedback, it will be good for you. Then you will get more cases. You should be very confident. It is not possible to know everything. Even the surgeon doesn't know everything. If you have knowledge and skills, you should be confident. When the surgeon is sending you to the patient's place, you should not be fumbling. In today's date, it is very easy to reach a surgeon over a phone call or sending him a picture on the WhatsApp. If you're a junior assistant, you can take your senior with you for 2 or 3 months. In the initial days, you need to focus on your image and attitude rather than the money. If you couldn't understand whether the wound is healing or any infections are developing in that particular wound, please do not mislead the patient with any false information. Do communicate with the surgeon for further assistance. Or bring the patient to the surgeon so that the surgeon can take proper decision, because sometimes it's a problem of the wound and sometimes it's a problem of the wrist drop or foot drop, or that has been missed previously. You have to escalate this to the surgeon. But at the same time, don't embarrass the surgeon by telling anything regarding any complication in front of the patient so that the patient doesn't get panicked. You have to take care of that with intelligence. So to sum up, what the surgeon is seeing about his assistant first is technical knowledge, second, reliability, third is honesty, fourth is thoroughness. Thoroughness means you have to take care of every point minutely. It's not like I have seen 1 or 2 points and I have missed out one important point. It should not be like that. Like one has checked the wound, but he did not check whether the patient is taking the antibiotics or not, whether the dressing is done properly or not. The surgeon has told the patient that he or she should use scratch while walking, and have seen the patient has not been using that. It should not be like this. They have to work hard willingly, else nothing is going to happen. Technicians are the most hardworking person in the hospital. They have to work hard. They have to be available most of the time. If there is any complication or complicated situation that has occurred, they have to be there. When the surgeon needs any assistance, they have to come, even if it is all of a sudden. If there is any process of sterilization, they are the only one who does that. Punctuality is very important. If surgeon calls you for an operation and the operation time is at 7 a.m., you have to be there 10 minutes prior to that. You cannot be late. You have to maintain all these protocols efficiently, else you will be facing a very hard time. Next, you should be having your personal vehicle like a bike. Nowadays, due to the COVID situation, one should have their personal vehicle. Even if you think you won't be able to make it to the OT, as an assistant, you have to let the surgeon know about it priorly. You have to be very transparent and truthful towards your work. Another point is to avoid gossiping and politics inside your work premises. Whenever you are there inside the OT, you should not talk about anything else which is not regarding the work. It's better not to talk much inside the OT due to hygiene protocols. If you talk which is not related to your work inside the OT, you will miss out on important points, and that could be a distraction to your work as well. Do not try to indulge in any kind of foul politics inside your work premises. There are a lot of politics that happens within the institute, within the surgeon. Try to stay away from these politics. The doctors who are there are very much skillful because they are well trained to do their particular job. Firstly, work more, talk less. Secondly, be very serious about the patient. Like the monitor, ask for any kind of assistance if you find any problem. If there is any problem, tell the anesthetist. Like if you change the position and the airway moves apart, you need to inform that to the anesthetist. If you have to change the position of the patient, please check the airway, else the saturation might fall, and we all can face a lot of problems. Next, never use the C-arm unprotected. Be very careful to protect yourself and try to protect your colleague also, especially girls, the nursing staff. Most of them are unmarried, or they are planning to get a child, or they are in early stages of pregnancy. Try thinking about them and take good precautions. Try to be respectful to your juniors as well. Do not treat them harshly. I have seen people who treat their junior very harshly. They specifically think that they know much more than what the juniors know. That's the reason they treat them very harshly. Try not to do that. The quality of a person you can only judge by seeing how they treat their juniors. A person who is more junior to you today will be your colleague after a few years. And at that point in time, he can treat you the same way you did to him. Please be nice to them because that is very important. Try not to indulge in those things which you are not entitled to or which are not necessary. Try to emphasize those things which are entitled with your job. The problem that I have seen in West Bengal, which I didn't see in abroad, I'm going to blame the surgeon as well. I have seen people speaking very loudly. Sometimes I feel when I enter an OT, I feel like I have entered a fish market. It's not necessary to create a very loud environment. If you want to say something, you can speak softly. You don't have to shout. People who are the leader of our country, they don't shout. People like our ex-Prime Minister Manmohan Singh and our current Prime Minister Narendra Modi, they don't shout. It's not necessary to shout. People will listen to you, so speak softly. The final thing is to work hard but enjoy your life as well at the same time. Take holidays, enjoy yourself. Do not treat your life as that you have to work every day. Enjoy your life as well. Have a good life and have a good attitude towards your work. Thank you.
If you have enjoyed the video, like it, share it. If you are new to our channel, subscribe it. Hit the bell icon to get the notifications for our upcoming videos. If you have any queries, comment below and we will surely reply back. If you want to know more about career prospects in orthopedic implant industry and wish to start a career in orthopedic implant industry, please click the link below in the description box and DM us to know more. Thank you and see you in our next video.